Uric acid silently attacks your joints and kidneys, and most people suffers from this dangerous chemical but don't even know it. Uric acid silently attacks your joints and kidneys, and most people suffers from this dangerous chemical but don't even know it. Welcome all again to channel. Today we're discussing uric acid and its impact on joint and kidney health. On WA Health and Care, we explore trusted insights. As Dr. Sarah Jarvis notes, monitoring uric acid is vital. Stay tuned to learn the causes, symptoms, and natural ways to manage it for better health. What is uric acid? Presented by WA Health and Care, your trusted source for global health awareness, uric acid is a natural chemical produced when the body breaks down purines, compounds found in foods like red meat, organ meats, seafood, and certain alcoholic drinks. Under normal conditions, uric acid dissolves in the bloodstream, passes through the kidneys, and is released in the urine. However, when your body produces too much uric acid or your kidneys fail to remove it efficiently, it begins to build up in the blood. This excess can form sharp, needle-like crystals in the joints, leading to inflammation, pain, and a painful condition known as gout. According to Dr. Sarah Jarvis, a respected UK general practitioner and health broadcaster, high uric acid levels are far more common than people realize. Lifestyle, diet, and hydration play a vital role in controlling them. People with elevated uric acid often notice no symptoms until a gout attack suddenly occurs, usually in the big toe, ankles, or knees. The pain can appear overnight, often intense enough to disturb sleep. If untreated, this condition can lead to chronic arthritis or kidney stones. In the United States, Dr. Robert Terkeltaub, rheumatology specialist at UC San Diego Health, explains, even slightly raised uric acid levels can silently harm joints over time. Monitoring and lifestyle adjustments are crucial. At WA Health and Care, we believe awareness is the first step toward prevention. Understanding uric acid isn't just about avoiding gout, it's about protecting your joints, kidneys, and overall health through smarter daily choices. What are causes of high uric acid? Presented by WA Health and Care, your trusted global health. High uric acid, medically known as hyperuricemia, develops when the body produces more uric acid than it can remove. Normally, uric acid is filtered through the kidneys and passed out in urine. However, when this natural process is disrupted, the excess begins to accumulate in the blood. Over time, these uric acid crystals can settle in the joints, causing severe pain, inflammation, and gout. According to Dr. Robert Terkeltaub, a leading rheumatology specialist at UC San Diego Health, most uric acid imbalances are lifestyle-related. What we eat, drink, and how much we move all directly affect our uric acid levels. One of the major causes is a purine-rich diet. Foods such as red meat, organ meats, like liver or kidneys, shellfish, and oily fish like anchovies or sardines are loaded with purines, chemical compounds that increase uric acid production when broken down in the body. Another key factor is excessive sugar and alcohol intake, particularly drinks containing fructose and beer. Fructose metabolism triggers uric acid production, while alcohol interferes with the body's ability to remove it effectively. Obesity and lack of physical activity also contribute significantly. Being overweight not only increases uric acid production but also makes it harder for the kidneys to filter it out. Similarly, chronic dehydration, not drinking enough water, allows uric acid to concentrate in the blood, raising the risk of gout and kidney stones. Certain medications, such as diuretics for high blood pressure or treatments used in cancer therapy, can elevate uric acid levels. In some individuals, genetic factors or underlying metabolic conditions like diabetes, hypertension, and kidney disease may also play a role. As Dr. Sarah Jarvis, UK general practitioner and health expert, explains, maintaining hydration, moderating alcohol, and balancing diet can naturally reduce uric acid buildup. At WA Health and Care, we emphasize prevention through awareness. Understanding these causes helps you take control, protecting your joints, kidneys, and overall well-being with smarter lifestyle choices. What are the symptoms of high uric acid? High uric acid, or hyperuricemia, often develops silently. Many people have elevated levels for months or even years without noticing any warning signs. However, when uric acid crystals begin to accumulate in the joints or kidneys, clear and painful symptoms start to appear, especially in conditions like gout. According to Dr. Sarah Jarvis, a UK-based general practitioner and health broadcaster, the first sign of high uric acid is often sudden joint pain that appears overnight, usually in the big toe or ankle. People are often shocked by how intense the pain can be. The most common symptom is joint pain and inflammation. The big toe is the area most frequently affected, but the pain can also occur in the knees, elbows, wrists, and fingers. The affected joint becomes swollen, red, warm, and extremely tender to touch. Even the weight of a bedsheet can cause discomfort. These attacks can last from a few days to several weeks, and often return if the underlying uric acid levels remain high. In addition to joint pain, people with high uric acid may experience stiffness and limited mobility, particularly in the morning or after long periods of rest. Persistent uric acid buildup can lead to chronic gout, where the joints remain swollen and painful even between flare-ups. Another common complication is kidney stones, formed when uric acid crystals collect in the urinary tract. Symptoms may include back pain, abdominal pain, or blood in the urine. In severe cases, prolonged uric acid elevation can damage the kidneys, leading to reduced kidney function. As Dr. Robert Terkeltaub from UC San Diego Health notes, even mild hyperuricemia can cause silent joint or kidney damage. It's a warning sign, not something to ignore. At WA Health and Care, we remind you that early recognition is key. If you experience joint pain, swelling, or unexplained fatigue, it's time to get your uric acid levels checked. Awareness and timely action can protect your joints and long-term health. How to control or reduce uric acid naturally. Managing uric acid naturally is not only possible but also highly effective when done consistently. Since most cases of elevated uric acid are linked to diet and lifestyle, small daily changes can make a significant difference in preventing gout, joint pain, and kidney issues. According to Dr. Sarah Jarvis, a UK general practitioner and health expert, the most powerful tool against high uric acid is prevention. You can reduce levels simply by improving hydration, eating a balanced diet, and maintaining a healthy weight. The first and most important step is to stay hydrated. Drinking enough water helps your kidneys flush out uric acid more efficiently. Aim for 2 to 3 liters of water a day, depending on your activity level and climate. Next, limit purine-rich foods. Reduce your intake of red meat, organ meats, seafood like anchovies or sardines, and processed meats. Instead, choose lean proteins such as chicken, eggs, and plant-based sources like lentils or tofu. Cut back on sugary drinks and alcohol, especially beer and spirits, as they increase uric acid production and strain the kidneys. Replace them with herbal teas, infused water, or low-sugar fruit juices. Maintain a healthy body weight through regular exercise and portion control. Obesity slows uric acid removal, so even modest weight loss can bring noticeable improvement. Gentle activities like walking, yoga, or swimming are beneficial for both circulation and joint health. Add more fruits and vegetables to your meals, particularly cherries, berries, and citrus fruits, all of which have been shown to help lower uric acid levels naturally. As Dr. Robert Terkeltaub, rheumatology specialist at UC San Diego Health, notes, lifestyle modification remains the foundation of uric acid control. Medication helps, but daily choices make the biggest impact. At WA Health and Care, we encourage you to take proactive steps. Drink well, eat smart, and stay active. Your joints, kidneys, and overall well-being will thank you in the long run. What are precautions, foods, and medicines? Managing uric acid effectively involves a combination of precautions, dietary choices, and, when necessary, medication. Taking these steps can help prevent gout attacks, joint pain, and kidney complications. Precautions. The first step is lifestyle management. Staying well hydrated is crucial, as water helps flush uric acid through the kidneys. Aim for at least 2 to 3 liters daily. Maintaining a healthy body weight is also essential. Obesity increases uric acid production and reduces kidney efficiency. Regular physical activity, even light exercises like walking, yoga, or swimming, improves circulation and supports overall joint health. Limiting alcohol, particularly beer and spirits, and avoiding sugary drinks reduces the strain on your kidneys. Foods. Diet plays a pivotal role in controlling uric acid. Reduce purine-rich foods such as red meat, organ meats, shellfish, and oily fish like sardines and anchovies. Instead, focus on low-purine proteins like chicken, eggs, and plant-based sources such as lentils, beans, and tofu. Incorporate fruits and vegetables, especially cherries, berries, and citrus fruits, which are known to help lower uric acid naturally. Whole grains, nuts, and low-fat dairy can also support healthy uric acid levels. Avoid processed and high-sugar foods that can trigger uric acid spikes. Medicines. In some cases, lifestyle and diet alone may not be enough. Doctors may prescribe allopurinol, febuxostat, or probenecid to help reduce uric acid production or improve its excretion. NSAIDs like ibuprofen or colchicine are sometimes used to relieve pain during acute gout attacks. It's essential to take medicines only under medical supervision and combine them with lifestyle changes for maximum benefit. As Dr. Robert Terkeltaub, a rheumatology expert at UC San Diego Health, explains, medication can control uric acid, but long-term prevention relies on diet, hydration, and healthy habits. At WA Health and Care, we emphasize that awareness, balanced nutrition, and timely precautions are the keys to managing uric acid safely. With the right approach, you can protect your joints, kidneys, and overall health for the long term. High uric acid can silently damage your joints and kidneys, but simple lifestyle changes make a big difference. Stay hydrated, eat balanced, and move regularly. Have you checked your uric acid levels recently? Comment below and share your experiences. We'd love to hear from you.